thought-provoking question from one of my patients this morning. She was surprised that we could do something with her leg in a certain movement pattern that changed her brain function. And we did this what we call a complex movement with her leg, and then her balance improved and her convergence improved, and she stood up with less dizziness and all of these types of things. And so we're talking about this, and something that I kind of realized that people don't really think about is that information comes from our body to our brain. We always think about information coming down from our brain to the body to control the body. But what we don't think about a lot of times is that in order for that to occur, we actually have to have information coming in from the body to the brain. And it occurs through these little sensors in our joints and muscles and different tissues called receptors. And these sensors, when you move them and stretch them, or you stimulate them a certain way, what they do is they activate certain parts of the brain. Each area is connected with different parts of the brain. So for instance, in this patient's case, the right hip is connected more with the right lower brain stem, which is connected with this autonomic nervous system, which helps us pump blood to our brain. So we were able to stimulate that pathway and activate the brain in such a way that it changed the functionality or the calibration of that process and improved function. And then if you do that enough times, it changes it completely, because the brain requires stimulation. So when we activate these little sensors, they send a stimulus up the nerves, and it's like a charge. And this charge goes up the nerves, and it charges the part of the brain that receives that information. And that area, once it gets charged, it gets a little healthier. What it does is it makes more cellular constituents. It connects with other areas, makes more connections in the brain. But just understand that it gets healthier. And if you charge it over and over and over again enough, this charging process ends up creating a healthier brain function in that area, and symptoms resolve. So when we're looking at the brain and the body, they're not distinct, separate things. They're connected, and it's bi-directional, meaning the information coming into the brain from the body is just as important as the information coming out. And so a lot of times we forget that there's a two-way street there. How we're able to help people with functional neurology and chiropractic neurology is because we understand this process and how all of the body integrates with the brain, and how the brain integrates with the body, and where each area connects with. And when we can do that, we can direct treatment and change the way your brain functions and the way your body functions, recalibrating and restoring normal activities and getting rid of symptoms and dysfunction.